Good day. Today we have a bipolar disorder. Now you will see the presentation that was made by one of the students that was before you. Anyway, this presentation is much more simple than we have on our website, but uh, the really plus here is its easy content. So, let's start. Bipolar disorder. Bipolar disorder, also known as manic depressive illness, is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day to day tasks. People with bipolar disorder experience unusually intense emotional states that occur in distinct periods called mood episodes. An overly joyful or overexcited state is called a manic episode, and an extremely sad or hopeless state is called a depressive episode. Sometimes a mood episode includes symptoms of both mania and depression. This is called a mixed state. So, here are symptoms of both types of bipolar disorder. So, when we see a manic episode, we see some mood changes, a long period of feeling high, or an overly happy or outgoing mood, and extremely irritable mood, agitation, feeling jumpy or wired. And on the other side, when we see depressive episode, at the mood, we can see next changes. So a long period of feeling worried or empty, and loss of interest in activities once enjoyed, including sex. So there are also behavioral changes. At the manic episode, we see talking very fast, like the Eminem at his best ages, jumping from one idea to another, having racing thoughts, being easily distracted, increasing goal-directed activities such as taking on new projects, being restless, sleeping little, having an unrealistic belief in one's abilities, and behaving impulsively and taking part in a lot of pleasurable high-risk behaviors such as spending sprees, impulsive sex, and impulsive business investments. On the other side, when we have depressive episode, we see next changes at behavioral activities. So feeling tired or slowed down, having problems concentration, remembering and making decisions, being restless or irritable, changing eating, sleeping or other habits, thinking of death or suicide or attempting suicide. So, next symptoms are also lead us to the bipolar disorder. During a mixed state, symptoms often include agitation, trouble sleeping, measured changes in appetite, and suicidal thinking. People in a mixed state may feel very sad or hopeless while feeling extremely energized. Sometimes, a person with severe episodes of mania or depression has psychotic symptoms too, such as hallucinations or delusion. The psychotic symptoms tend to reflect the person's extreme mood. People with bipolar disorder may also have behavioral problems. They may abuse alcohol or substances, have relationship problems, or perform poorly in school or at work. So, there are 4 types of bipolar disorder. By the way, to the exam, or maybe just to measure activity, you have to know 2 of them. So, type 1, bipolar disorder, first type, is mainly defined by manic or mixed episodes that last at least 7 days, or by manic symptoms that are so severe that the person needs immediate hospital care. Usually, the person also has depressive episodes, typically lasting at least 2 weeks. The symptoms of mania or depression must be a major change from the person's normal behavior. So, there is going type 2. Type 2 is defined by a pattern of depressive episodes, shifting back and forth with hypomanic episodes, but no full-blown manic or mixed episodes. Type 3. Bipolar disorder not otherwise specified is diagnosed when a person has symptoms of the illness that do not meet diagnostic criteria for either bipolar 1 or 2. The symptoms may not last long enough, or the person may have too few symptoms to be diagnosed with bipolar 1 or 2. However, these symptoms are clearly out of the person's normal range of behavior. And type 4. Cyclothymic disorder or cyclothymia is a mild form of bipolar disorder. People who have cyclothymia have episodes of hypomania that shift back and forth with mild depression for at least 2 years. However, the symptoms do not meet the diagnostic requirements for any other type of bipolar disorder. Some people may be diagnosed with rapid cycling bipolar disorder. This is when a person has 4 or more episodes of measured depression, mania, hypomania, or mixed symptoms within a year. Rapid cycling seems to be more common in people who have severe bipolar disorder and may be more common in people who have their first episode at a younger age. So, some risk factors. Genetics. Bipolar disorder tends to run in families, so researchers are looking for genes that may increase a person's chance of developing the illness. Genes are the building blocks of heredity. They help control how the body and brain work and grow. Genes are contained inside a person's cells that are passed down from parents to children. Brain imaging studies are helping scientists learn what happens in the brain of a person with bipolar disorder. Newer brain imaging tools, such as functional magnetic resonance imaging and positron emission tomography, allow researchers to take pictures of the living brain at work. These tools help scientists study the brain structure and activity. So, we have some steps at the diagnosis of bipolar disease. The first step is getting a proper diagnosis is to talk to a doctor who may conduct a physical examination, an interview, and lab tests. Bipolar disorder cannot currently be identified through a blood test or a brain scan, but these tests can help rule out other contributing factors such as a stroke or brain tumor. Right here, I want to say you one more point. When I see a person who probably has bipolar disease, I always ask him to make some blood test to lithium, just because people with bipolar disease has extremely low currency of lithium. So probably they have maybe 0.01 and the normal rate starting from 6.5, so something like this, just because that's the one of the reason of growing up of bipolar disease. So, next step, the doctor may conduct a mental health evaluation he or she should discuss, and family history of bipolar disorder or other mental illness, and get a complete history of symptoms. Also talk to the person's close relatives or suppose a note how they describe the person's symptoms and family medical history. Next, we start to treat our patient. Because bipolar disorder is a lifelong and recurrent illness, People with the disorder need long-term treatment to maintain control of bipolar symptoms. An effective maintenance treatment plan includes medication and psychotherapy for preventing relapse and reducing symptom severity. So, medication. Not everyone responds to medication in the same way. That's the golden rule, by the way. Several different medication may need to be tried before the best course of treatment is found. Keeping a chart of daily mood symptoms, treatments, sleep patterns, and life events can help the doctor track and treat the illness most effectively. Sometimes this is called a daily life chart. By the way, this is the reason why I'm always on chat, maybe, or just on phone with all of my patients, just to have a chance to have really good tracking. So maybe that's the key. Mood stabilizing medications are usually the first choice to treat bipolar disorder. In general, people with bipolar disorder continue treatment with mood stabilizers for years. So, and the first point here is lithium. That's why I just said you that I ask blood tests to lithium at the blood. So just because that's really often and natural reason to this disorder. So first is lithium, second valproic acid or divalproic sodium, third anticonvulsant lamotrigine, for example Lamictal, 4 other anticonvulsant medications including gabapentin, topiramate, and oxcarbazepine, and sometimes prescribed. Also, we use a typical antipsychotic, which may be sometimes used to treat symptoms of bipolar disorder. Often these medications are taken with other medications. So, Zyprexa, olanzapine, is given with an antidepressant medication, may help relieve symptoms of severe mania or psychosis. Olanzapine is also available like injectable form, which quickly treats agitation associated with a manic or mixed episode. Second is aripiprazole. Abilify, like olanzapine, is approved for treatment of a manic or mixed episode. Aripiprazole is also used for maintenance treatment after a severe or sudden episode. So, my favorite is quetiapine. He is also Seroquel, like trading name. Relieves the symptoms of severe and sudden manic episodes. In that way, quetiapine is like almost all antipsychotics. He is rather soft, and as for me, I am using quetiapine in really many ways to correct some sleeping problems, to correct some psychotic problems, and if I give it to low doses, patient probably and usually is not having some health problems or some occasions after taking this. So, 4 risperidone and ziprasidone are other atypical antipsychotics that may also be prescribed to controlling manic or mixed episodes. Antidepressant medications are sometimes used to treat symptoms of depression in bipolar disorder. People with bipolar disorder who take antidepressants often take a mood stabilizer too, and any anticonvulsants are mood stabilizers, just for you to understand. Doctors usually require these because taking only an antidepressant can increase a person's risk of switching to mania or hypomania, or of developing rapid cycling symptoms. To prevent this switch, doctors who prescribe antidepressants for treating bipolar disorder also usually require the person to take a mood stabilizing medication at the same time. So our standard therapy is an antidepressant, some anxiolytic, I mean tranquilizator, something like Atarax, Grandaxin, and some mood stabilizing medication, so lamotrigine, carbamazepine, Sedalit, and etc. Here we see some antidepressants: fluoxetine, paroxetine, sertraline, and bupropion. They are antidepressants that may be prescribed to treat symptoms of bipolar depression. I want to add that I love anafranil, like the one of the most strongest antidepressant in curing bipolar disease. So just have a note on this. Thanks for your attention, and see you later. Have a good day.